Welcome to CPT Coding Guidelines Review, Colonoscopy. Achieving accurate and complete coding is the purpose of coding guidelines. However, you can't take advantage of the benefit of having guidelines if you don't know what direction they provide. Even if you don't know the specifics of a guideline, just being aware that guidance is available for a particular situation is valuable. This series is designed to help you become better acquainted with often unfamiliar CPT guidelines for coding of significant procedures, with the intent of making you aware that the guidance exists to ultimately improve coding proficiency and boost confidence in your ability to code these procedures. The guidelines are waiting, so let's get started. Knowing something about the objective of a procedure and/or how the procedure is performed always promotes understanding of the direction given in the guidelines. This installment of CPT Coding Guidelines Review covers the guidelines for coding colonoscopy procedures. So, before we dive into the guidelines themselves, let's take a quick look at the different types of endoscopic procedures performed on the colon and rectum. A proctosigmoidoscopy is an examination of the rectum. This exam may also include a portion of the sigmoid colon. If the rectum and the entire sigmoid colon are examined, the procedure is a sigmoidoscopy. This procedure may also include examination of a portion of the descending colon. A colonoscopy includes examination of the entire colon from the rectum to the cecum. Colonoscopy may include examination of the terminal ileum, or in instances of resection of the ileum, the portion of the small intestine proximal or closest to the anastomosis. If colonoscopy is performed through a stoma, the procedure examines the entire colon from the stoma to the cecum and may include the terminal ileum or the small intestine proximal to any anastomosis. When a diagnostic or screening endoscopy is performed on a patient who is scheduled or prepared for a colonoscopy, if the physician is unable to advance the scope to the cecum or colon small intestine anastomosis due to unforeseen circumstances, report code 45378 colonoscopy or 44388 colonoscopy through stoma with modifier 53 appended and provide appropriate documentation. If a therapeutic colonoscopy is performed and does not reach the cecum or colon small intestine anastomosis, report the appropriate therapeutic colonoscopy code 44389 to 44407, 45379 to 45382, 45384, 45388, or 45389 with modifier 52 and provide appropriate documentation. For patients who have undergone resection of the colon, report flexible sigmoidoscopy from codes 45330 to 45347 for endoscopic exam in patients who had resection of the colon proximal to the sigmoid and have an iliosigmoid or iliorectal anastomosis, or a code for pouch endoscopy 44385 or 44386 for patients with an ilioanal anastomosis. When colonoscopy is performed on a patient who has undergone segmental resection of the colon, such as hemicolectomy, sigmoid colectomy, or low anterior resection, a colonoscopy code from the range of 45378 to 44398 is reported. Colonoscopy performed through a stoma is reported with a code from the range of 44388 to 44408, depending on whether the colonoscopy is diagnostic or, if therapeutic, the type of therapeutic procedure provided, such as biopsy, removal of foreign body, control of bleeding, etc. For patients who have undergone colectomy, examination of the no longer functioning portion of the rectum or distal colon is reported with a code for proctosigmoidoscopy, flexible sigmoidoscopy, or anoscopy, depending on how far the scope is advanced. These codes may be reported in conjunction with codes to report examination of the functional part of the colon, namely colonoscopy through stoma or ileoscopy through stoma. Control of bleeding that occurs as a result of an endoscopic procedure during the same operative episode is not separately reportable. To report colonography performed via computed tomography, or CT, see codes 74261 to 74263 from the radiology section of CPT. This decision tree outlines the colonoscopy code that should be reported, or range of codes from which a code is selected, and modifiers, if applicable, based on whether the colonoscopy was diagnostic or therapeutic and how far the scope was advanced. For example, if a colonoscopy is diagnostic and the scope is advanced beyond the splenic flexure, but not all the way to the cecum, code 45378, colonoscopy, flexible, diagnostic, is assigned with a modifier 53, discontinued procedure, to indicate the procedure was terminated before the scope reached the fullest extent of the colon that should be examined to constitute a colonoscopy. Thanks for watching. Health Information Associates is committed to providing educational products that help coders to be their best. So be sure to check out the other presentations in the CPT Coding Guidelines Review series, as well as our full catalog of courses at hialearn.com.